Okay guys, this is fifth part of this series. Okay, let's start. First drug is Duloxetine, serotonin norepinephrine receptor inhibitors, SNRIs. SNRIs block the reuptake of norepinephrine and serotonin from the synaptic cleft, thereby potentiating their effects on the postsynaptic receptor. SNRIs have been used to treat depression and generalized anxiety disorder. Duloxetine is also used to treat diabetic neuropathy. Side effects are hypertension and tachycardia, due to increased sympathetic tone, nausea, sexual dysfunction. Next drug is ranitidine, which is well known as H2 receptor blockers. This class of drugs acts by reversibly blocking the binding of histamine to the H2 receptor, result in decreased activity of the hydrogen-potassium proton pump. The end result is that gastric acid secretion is decreased. Used as treatment of gastroesophageal reflux disease, peptic ulcer disease, and other diseases associated with gastric ulcers. Side effects are headache and stomach cramps. Next drug is Lafaxine, serotonin norepinephrine receptor inhibitors, SNRIs. SNRIs block the reuptake of norepinephrine and serotonin from the synaptic cleft, thereby potentiating their effects on the postsynaptic receptor. SNRIs have been used to treat depression and generalized anxiety disorder. Lafaxine may also be used for panic disorder and social anxiety disorder. Side effects are hypertension and tachycardia, due to increased sympathetic tone, nausea, sexual dysfunction. Next drug is zolpidim. Zolpidim is a GABA receptor agonist. With increased GABA activity, the flow of chloride ions through adjacent chloride channels is increased, which leads to cell membrane hyperpolarization and decreased activity of CNS neurons. Clinical uses of zolpidim is short-term treatment of insomnia. Side effects are mild anterograde amnesia, hallucinations, ataxia. Next drug is warfarin. Warfarin inhibits the vitamin K-dependent gamma carboxylation of factors 2, 7, 9, 10, and protein C and S in the liver, used for chronic anticoagulation in patients who are at risk for thromboembolic events, or who have had a thromboembolic event. Side effects are bleeding, skin changes, teratogen. Next drug is allopurinol. Allopurinol acts to inhibit xanthine oxidase, an enzyme in the purine degradation pathway that is responsible for converting xanthine to uric acid. Used for prevention of further gouty attacks, prevention and treatment of hyperuricemia. Side effects are GI upset, hypersensitivity reactions. Next drug is azithromycin, from macrolides class. Azithromycin is a protein synthesis inhibitor. It binds to the 50S ribosomal subunit and inhibits the formation of the initiation complex. Used to treat upper respiratory infections. The azithromycin are effective against gram-positive cocci such as streptococci, staphylococci, Corynebacteria species, and rare atypical organisms. Side effects are GI upset, acute cholestatic hepatitis, skin rash, eosinophilia. Next drug is acetazine. It acts by blocking H1 histamine receptor sites. By blocking these receptors, acetazine is able to produce bronchodilation, decreased pruritus, decreased peripheral vascular resistance, decreased GI tract motility, and decreased rash formation. Used to treat allergic rhinitis and other symptoms of seasonal allergies. Side effects are mild sedation, GI upset. Next drug is azepam, the intermediate-acting benzodiazepines. Act by enhanced GABA receptor activation, leads to increased flow of chloride ion through adjacent chloride channels and leads to hyperpolarization and decreased activity of the neurons of the limbic, thalamic, and hypothalamic regions of CNS. Used to treat acute anxiety, seizures and status epilepticus, muscle spasms, alcohol withdrawal, insomnia, and panic disorder. Side effects are sedation, altered mental status, ataxia. Next drug is lamotrigine, acts to block fast voltage activated sodium channels at the presynaptic neuron, thereby decreasing the release of glutamate and aspartate at the neuronal synapse. Used in the treatment of epilepsy, simple and complex partial seizures and generalized tonic-clonic seizures. Side effects are Stevens-Johnson syndrome, that is, malaise and fever prodrome followed by rapid onset of diffuse purpuric macules that involve the mucous membranes, toxic epidermal necrolysis, aseptic meningitis,